What is chronic anemia? Anemia is a condition where a person does not have enough red blood cells, leading to a lowered level of hemoglobin. If this condition persists, usually longer than 2 to 6 months, it is considered chronic anemia. Red blood cells and hemoglobin play a vital role carrying oxygen to the rest of the body, and a deficiency can lead to a variety of unpleasant symptoms. Chronic anemia can be primary, meaning it is part of the patient's main medical diagnosis, or secondary, that is, caused by another underlying medical problem. One of the most important components of blood are the red blood cells, and a person with chronic anemia lacks a sufficient amount of these vital cells. This condition is commonly called a low red blood cell count. Red blood cells carry oxygen from the lungs to all other parts of the body and transport carbon dioxide back. They utilize a molecule called hemoglobin as the vehicle of transport. When there is a lack of hemoglobin, also called hemoglobin deficiency, the tissues and organs of the body won't get enough oxygen, leading to fatigue-like symptoms. Symptoms of chronic anemia include lack of energy, pale skin, weakness, shortness of breath, lightheadedness, palpitations, dizziness, and irritability. Some other less common symptoms include fainting, chest pain, difficulty sleeping, ringing in the ears, inability to concentrate, and impotence. Most of these symptoms are caused by the lack of vital oxygen to body tissues. Many patients with chronic anemia adapt to their condition and show very few symptoms unless there is a sudden change in their hemoglobin levels. Potential causes of chronic anemia are divided into 3 main groups: anemia caused by blood loss, by lowered or flawed red blood cell manufacture, or by the destruction of red blood cells. One of the most common of these is iron deficiency, which reduces the body's ability to manufacture red blood cells and hemoglobin. Chronic anemia always has an underlying cause. When the cause is a disorder which mainly affects the blood, such as sickle cell disease, it is considered primary chronic anemia since it is often a normal part of the disease. When it is caused by a non-hematological condition such as alcoholism, cancer, tuberculosis, or renal problems, it is considered secondary because it is a symptom of another disease process. There are more than 400 possible causes, and effective treatment usually depends upon treating the underlying cause.